Hi, this is day 6. I'm in a substantial amount of pain today. I'm feeling really frustrated with my surgeon and his team. I communicated with them really clearly prior to my surgery that the genetic testing that I had done shows that I metabolize pain medications, opioids and opiates, differently than other people do. I think it says I'm a rapid metabolizer. I just know it doesn't work like as long as it should, and it doesn't work as well as it should. And I communicated this 2 or 3 different times prior to my procedure, and it was like, no, it's okay, we understand. There's the added complication of me not being able to take Advil because I'm on blood thinners. And every time I contact them to be like, hey, I'm almost out of painkillers, they're like, oh, well, you should really be doing Tylenol and Advil. And I'm left to be like, okay, well, that would mean only Advil because I can't take Tylenol because I'm on blood thinners. And they really didn't want me taking like the strong pain meds anymore, which would be fine if that had been their story all along. But my frustration lies in the fact that I expressed all these concerns to them prior to surgery, and they were like, oh no, we've got you, not a big deal, like we'll just send in a new script when you need one. And now they're like, well, we've never even given anyone that many before, and like addiction becomes a concern. And I'm like, you're not listening. The medication doesn't work for as long as it's supposed to. It doesn't work as effectively as it is supposed to. I'm not addicted to it. I just want the pain to stop. So finally today he offered me Tramadol, and I was like, you know what? Sure, whatever. I'll give me the Tramadol. And he sent in a dose of 50 milligrams 12 times. And I've been on and off of Tramadol for years because of back issues, neck issues, leg issues from blood clots, just chronic pain stuff. And if I don't take 100 milligrams of Tramadol, it does nothing for me. So I'm supposed to be taking half of what is the effective dose for me of Tramadol and Tylenol until I see the doctor on Monday. And then we'll be having a conversation about all of this, because I don't feel like my concerns about my pain have been taken seriously, because I feel like I was misled about their policies about the pain medications. Because every time that I've spoken to the doctor or the nurse, they've been like, oh, well, you should just take Advil. And I have repeatedly had to tell them, I cannot take Advil. I am on blood thinners. Repeatedly. I've told them that at this point at least 5 times, between the nurse and the doctor, the surgeon. So I'm frustrated, and I'm in pain, and like there's a leaky situation going on over here. My surgical pad that was covering that area is the nastiest one I've seen so far, and that kind of started last night. I'm just trying to breathe and remember that I will see the surgeon on Monday, and that I am actually happy with the work he did, even if I am not happy with him as a person. Great surgeon, questionable doctor, maybe. And I will be putting that in a Google review, but not until I'm done with all my post-op appointments. So yeah, my wish for you today is that you know how to advocate for yourself, and that when you're trying to advocate for yourself and it's not working, you find someone else who can advocate for you better. I'm to the point where, depending on how this appointment goes on Monday, I will be probably asking for a patient advocate if their practice has such a thing. I've been in hospitals that have had them before, and they've been mildly to moderately helpful, so we'll see how that goes. Also, I'm itchy today. Like everything's itchy. Yeah. Poor pitiful me. I'm just kidding. I'm grateful to have had this surgery. I'm grateful to have found a surgeon who was willing to do this surgery on someone of my BMI, even if he was kind of an ass about my BMI. I'm grateful that it's done. I'm grateful that it's done in time for when I'm at my out-of-pocket maximum before that resets for the year. I'm grateful for my weighted dino, Sarah. She's sweet. She's comforting. Yeah, that's it for